Hi, I'm Dr. Jameson Spencer with Lane & Associates. This short video will explain some of the signs and symptoms of obstructive sleep apnea. Here we have a dramatization of a sleep apnea event. For many people, one of the hallmarks of sleep apnea is snoring with occasional pauses in their snoring. Normally, our airway is held open all the time while we're awake, but when we sleep, our airway can become narrowed or restricted completely. This results in our brain waking us up to a lighter level of sleep or even completely waking us up. This is a dramatization of a rather severe sleep apnea event. So what is sleep apnea? As the video shows, sleep apnea is basically the result of the tongue falling backwards, resulting in a partial or complete blockage of the airway. Our brain doesn't like it very much when we're not getting air, so it wakes us up to lighter levels of sleep, or even wakes us up completely. Sometimes we remember this, most of the time we don't. Now, sleep apnea can lead to all sorts of bad things for our overall health and well-being. For example, a heart attack. Sleep apnea might also lead to a stroke. It may lead to a feeling of fatigue, or even make us gain weight. For some people, they'll be misdiagnosed as being depressed or having heartburn. For some people, it will result in high blood pressure, and for some, unfortunately, premature death. Children get sleep apnea too. For them, it may lead to a diagnosis of ADHD or problems in school, or even bedwetting, nightmares and night terrors. Now, what does sleep apnea have to do with dentistry, you might ask? Well, it can result in breaking down of the teeth and fillings, periodontal disease, and even TMJ problems. Some of the signs and symptoms of sleep apnea include a feeling of fatigue, snoring, and the grinding and clenching of the teeth. However, were you aware that over 50% of people with sleep apnea really don't have any of these signs or symptoms? They just don't know that they have a problem. So how do you know if you have sleep apnea? Well, for starters, you can talk to your primary care doctor or a sleep physician to see if a sleep study might be right for you. If you're found to have sleep apnea, there are several treatments, the main one being CPAP, or a very simple to use oral appliance. The first step is to talk to your primary care doctor or a sleep physician. If you've already been diagnosed with sleep apnea and given up on CPAP, then a simple to use oral appliance may be right for you. The good news is they're covered by medical insurance. At Lane & Associates, we care about our patients' overall health, not just their teeth. If you think that you or someone you love may have sleep apnea, please talk to us about the next steps. Thank you.